Hi everyone, I'm Pyn Lim, founder of ECAMS. Welcome to Inside the Journey, a real conversation about what it takes to build a world-class facial surgery practice. In this episode, you'll hear 3 surgeons share how they built patient trust, aligned expectations, and found mentorship that changed their careers. Because mastery isn't taught in a weekend, it's built through experience, purpose, and the right path. So let's begin. Yeah. For those I have never met before, thank you for joining us. And I guess the reason why we wanted to do this webinar is that since we have actually all the fellows that we had for ECAMS, it makes sense for them to share their journey with you, just so that and their experience with you, so that it is easier for those people that has not been to ECAMS course before, understand what's going on. And for those that had already joined us, you can understand from their perspective what they have done in order to build a world-class facial surgery practice. So this is going to be more like a discussion format. So feel free, if any one of you wanted to ask questions, feel free to raise your hand, ask the questions to add to the 3 speakers, and feel free to make it interactive. I'm going to convert this into a podcast so that later on you guys can also listen to it and understand what's going on. So I bring the 3 of them together, distinguished surgeons who is also ECAMS fellow in aesthetics facial surgery, and had navigated all the challenges and established thriving practices while maintaining the highest standards of patient care and surgical excellence. I mean, if you have gone to all the 3 practice of theirs, you will be quite impressed what they have actually established. So in these discussions, you discovered all the very often unspoken truth, because most of the time everybody is talking about how great their surgery is, and nobody is talking about the pain points and the struggle and the real things behind the scene. So I want them to share as true as possible, so that you can have a better pictures what it takes in order to get there. So now about ECAMS, that is our focus for ECAMS is that we understand that mastering aesthetic facial surgery requires more than memorizing procedures or attending weekend congresses. So while others program, what their focus is solely on technical or product instruction, or in some cases is doctor's self-ego soothing instructions. But we wanted to take the comprehensive approach that addresses the complete journey, so that we can build world-class aesthetic facial surgeon or world-class aesthetic doctors. So our philosophy is very simple. So where others teach techniques, we want to build aesthetics surgeon. So what this means is developing not just surgical skills, but your clinical judgment, patient communication abilities, practice management expertise, and also your professional resilience. So we prepare you for the realities of building a sustainable, ethical, which is very important, grounded practice that serve your patient exceptionally well. So we all know that we are in the aesthetic industry. That means it's a service industry. That means patients are highly demanding. They want miracle. They want you to be not just a doctor to them. So these 3 surgeons have 3 very distinct journey. So I have Dr. Arnold Almonte. So he's from America. So he's the trust builder. So he has built a thriving facial surgery by prioritizing something that can't be taught in any textbook: genuine patient trust. His journey demonstrates that sustainable success comes not from aggressive marketing or social media metrics, but from creating authentic connections and consistently delivering on promise. So he'll share how building a foundation of trust transformed his practice and created lasting patient relationship that drive referral organically. one other thing is that Arnold is also very active in social media. So he probably will also share some of the insights, what he feels and what he thinks about it. And actually, same for Omar. Omar is also a very distinct, um, uh, he has a distinct journey and a surgeon, well respected. All three are plastic surgeon. So he learned a critical lessons early in his career that even if you have a flawless, perfect surgical technique, you can still result in an unhappy patient if your expectation aren't properly aligned. So his approach to preoperative counseling, and transparent communication has become a model for managing the complex psychology of aesthetic procedures. So he'll review the framework and conversation strategy that helps ensure surgical outcomes meet or exceed patients' expectations every time. And the next one is actually Dr. Anya Arellano, plastic surgeon from Mexico. And she is the mastery advocate. So Dr. Arellano, Anya, I would like to call her Anya, her path
All
of
right.
expertise taught her that the pursuit of certificates and credential alone doesn't create surgical excellence. And how I met Anya is actually through her father, and she's going to share with you, what brings her in from the father to her right now, being a fellow with us for two fellowships. She's actually also our fellowship in body surgery, so she has all the knowledge and gone through all the hard work. So you can ask her any questions that you want. So she discovered that true mastery comes from thoughtful mentorships, continuous critical thinking, and the willingness to question conventional approach. ECAMS is definitely not the conventional approach. So her insights on choosing educational opportunities wisely and developing genuine expertise over superficial qualifications will challenge common assumption about surgical training. And so the three mainly, I want to draw the today discussion so that we can narrow down, because there's a lot of things we can actually talk about. We can spend the whole day here, but we want to focus in these three main things. One is how to building the trust beyond followers, and the second one is to manage patient expectations, and the third one is choosing the right path to mastery. As you can see right now, everybody is an educator, everybody is a trainer. So it is so difficult for you to even know who to choose, which institution and which education is actually right for you, which congresses you should be attending, which one is product training, which one it is not, which one is sponsored, which one is not. So it's so difficult for a doctors to, I feel for you. I feel for you guys when you guys are trying to choose the right school. So we're going to go through these three main paths so that we can, and of course, if you guys have any other questions that is not stated here, please feel free to actually stop us and ask the questions. So with that, I actually want to go to the first, I'm going to stop sharing. I'm going to go to Arnold. If you can actually share with us your experience and what it takes, what you have to do. Go on, start.
Uh, so thank you so much for that introduction, Pyn. I'm a plastic surgeon in practice in Sacramento, Northern California for 20 years. So trust me when I tell you I have made my fair share of mistakes and I've learned. So I'm like an expert in learning from mistakes. But because of that, I've been able to really capitalize on that learning and been able to build a practice. And of course, when I joined ECAMS, or when I came in as a student with ECAMS and ultimately earned the fellowship, it simply just really added more to what I already had felt like I had learned from being in practice myself. And so I just want to share with you a little bit about the topic we're talking about today, which is trust. Um, one of the big things, and you mentioned it, Pyn, that we focus on as plastic surgeons, at least early on, is surgical skill, surgical technique, outcomes, results. We're always comparing between ourselves and other surgeons. And man, if I do it this technique or that technique, and we focus so much on that. that when it comes to building a practice, we lose sight of really the main thing that a practice is, and that is relationships. And the relationships with our patients is everything. And you can't have that without trust. Because without trust, I mean, you'll have patients come and go, but the ultimate goal of building a relationship with patients, on which trust is the main focus, is loyalty. And once you have achieved a degree of trust where now you have patient loyalty, that's really where the practice can be taken to all sorts of different levels, where you no longer really even need to market that much, because patients are referring others, their friends or family to you. If you think about why you go to, for example, certain restaurants all the time, you're very loyal to that place, because you trust exactly what you're going to get. And so building that trust has been something that I've learned over the years. Again, made a fair share of mistakes over the years, but it starts with you. And the only way that I can describe it is, until you are truly your authentic self, you can't really, I mean, it comes out to the patients, they'll see it if you're not really being authentic. And the way I'd view it, you can only really be authentic if you're doing what you truly love, what you truly enjoy. And so that's number one. You have to make sure that what you're doing is something you really love. And when you do that, and you're focused on that, it comes out, and patients can tell that. So in my practice, one of the things that I've done over the years is really try to establish the trust right away from the very first consultation. And in the consultation process, we have conversation, of course, and patients tell me what they're looking for, what they want. And it's at that moment in time where you can really lay the groundwork for the patient to become attached and develop a relationship with the practice. In the consultation process, I try to find out exactly what is bothering them and what we can do to help them and what they're looking for. But I also try to evaluate what their reasoning behind the reasoning behind coming in for a consultation is. And once you can identify that, then you can start to really build a relationship. And the relationship continues on not just in the consultation process, but in the actual surgery itself and the follow-up process. You have to really keep that relationship going by maintaining a good contact with the patient. I always tell others, like, do your own consultations, meet with the patient every time that they come in, and keep the communication lines always open with them. There's a lot of times you hear of practices where the doctor doesn't even meet with a patient. And so I think that's a fault that can hurt things right away. Another thing I tell patients is, once I put a scalpel on you, now we actually have a relationship. So they'll always have access to me and be able to communicate with me by phone, by text. And so we'll always have an ability to communicate with each other. And then in the post-op period, that's another area where I think sometimes, after the surgery is done, as surgeons, sometimes we relegate post-op care, what have you, to staff members. And I think that's also a mistake, because I think when you personally see patients and follow up, really take care of them over time, then that's when you can really build that relationship. The other thing that I always emphasize with patients is if they have any issues, any problems, any concerns, as you guys know, in cosmetic surgery, you're not always getting a happy patient right away. And sometimes there's difficult patients. And so you have to be able to manage them And by establishing good communication techniques, you'll be able to handle those kind of patients as well. So those are my thoughts on how trust is built in a practice. It starts from the consultation to the actual surgery, and then in the post-op period as well, where the communication is open, and knowing how to handle patients and talking to them is really the key.
I think for Arnold, I actually, while you're going through, I just have straight away for the audience, 30 of you guys here that is actually here to, I'm going to ask you questions when you said that during the consultations, is to build the trust, but have you ever able to kind of very define to, at that moment you realize that, that spot, that sweet spot, that patient finally said, you finally know that the patient actually really trusted you? Do you have that, do you know what are the tricks? Because you see,
Yeah.
sometimes when I see consultations done by doctors, they are quite, they were so rushed because you have given the consultation space, or the whoever, the planner, their secretary give you half an hour consultation because it's going to cost you 150. So within that half an hour, how did you jump it in, listen to their story, listen to what they want, and then build that trust?
That's a great question. I think it's one of those things that just comes with time. Early on in my practice as a younger surgeon, I was really focused on the technical aspects. I need to get these things out. I need to make sure they understand, how we do things and what the steps that to look for. But as I got older and more seasoned, this is funny to say this, but I learned to actually listen to my patients and listen to where they're coming from. And there definitely is that moment when you kind of see it in their eyes, when they sort of light up, and you realize, okay, this is a moment that we've captured. Now I can actually go right into all the different details about the procedure and post-op care and that sort of thing, which are all really just details. But in reality, what we're trying to do is establish that relationship. So that's why listening to them at the beginning, what is motivating them, and then trying to find a common ground with them that really connects you is key. And so that can come in different forms. Sometimes the patient will tell you exactly what they're looking for. Other times you have to sort of dig it out of them. But in the end, it's still about listening to your patient and addressing their needs.
That is one of also the empathizing, the ability to actually empathize with your patient. Do you think it is more important actually, if, as an aesthetic doctor or surgeons, that you should actually try to build that quality even you might not have and you couldn't get this?
Yeah, so listen, over the years, I used to think there was just one way to talk to patients, right? That there's only sort of one type of patient, someone who just comes in, you need to give them the information. And what we learned, and this is something that I've taught, and even in my own practice with students and what have you, is that there's really sort of four types of patients that come into cosmetic surgery practices, right? There's, and this has been studied, with questionnaires and what have you. You can identify sort of four personality types that come in. And we actually color coded them in our office. Like there's a green, there's a orange, there's a blue, there's a yellow. And if you come in and the patient is like, say, a green, which by the way, most of us are green, like 85% of people are green, but and then maybe 5% are yellow, 5%. If you come in and you meet with a patient who's a yellow, you can't talk to them the same way as someone who's a green. I can go over that real briefly. A green is someone who basically you can give information to, and they'll just take it at face value, and they'll think about it, and then they'll make a decision. A yellow is someone different. A yellow is someone as an individual who is like kind of a boss, maybe an owner, a producer, someone like that. For them, they take pride in making good decisions. You know, that's how they got where they are. So you can't go into there to that consultation just talking about like, hey, this is how the procedure is done. You almost have to first validate that they made a great decision coming to see you. And so that's the kind of person where you say like, oh, I'm, you know, double board certified, you know, I have all these credentials, because it makes sense to them that they made a good decision. Whereas a blue, on the other hand, is a patient who's very kind of needy, and someone who's, she's like the nice little old lady that brings cookies for everyone in the office, right? She established, you know, with that kind of patient, you don't need to go into the details of the difference between a SMAS lift or a D plane. You just tell her, we're going to take good care of you, and you know, we're going to make you look refreshed and that sort of thing. And then the last one is the orange, which is the most difficult type of patient. This is the one who has very little trust or mistrust, and they're the ones who question you as a doctor. You know, are you board certified? You know, how many of these have you done? What happens if you make a mistake? And so those are kind of patients that it's very easy as a surgeon to get defensive with, for example, and then the relationship doesn't proceed. But if you recognize that kind of patient, you can actually talk to them a different way, and now not only win them to your side, because that type of patient, while initially might sound difficult, if you can win them to your side, they become your most loyal. Like, hey, that's my surgeon, don't talk to him, don't talk about him like that. That's, they love you, but they take a minute to get through to. So, you know, learning how to identify the different personalities that you encounter in plastic surgery has been a huge key for me. And then once you establish that relationship, then the rest is sort of takes care of itself.
I think Kenneth here on the chat, he says that it's about discussing the safety of the procedure. And Antonio also say that you may be a good communicator and have an excellent practice, but it's very important to have empathy with the patient. This is the two feedback.
Yeah, absolutely. I mean, you know, as the patient tells you their story, in the end, you know, these are human relationships that we're talking about. And as a surgeon, just as a doctor, you know, you're listening to the story. And sometimes just from the history of the patient, you know, we'll talk patients out of surgery, right? So, you know, the good surgeons know when to operate, the great ones know when not to. So this is part of the communication of building trust. I had a lady that, you know, I told her, you know, you're not ready for surgery, and said we shouldn't do anything. And she came years later, and she was very appreciative. She said, you know, I really appreciated that you told me not to do anything back then. And now I think I'm ready. But it was because I declined her early on that she felt like, you know, this is someone that I can trust. You know, they're not just, you know, here to take my business and that sort of thing. So that's part of building the trust with patients, is just treating them like a human and creating a relationship with them.
So tell us one incident that the most difficult challenge that you have from building
Oh
the,
gosh.
yeah.
I mean, I think in the end, one of the most challenging things as we face as surgeons is the unhappy patient, right? I mean, you feel like you put in your heart, you know, you did the best work that you can do, and the patient comes back and they're, you know, I'm not happy with this, I don't like this, and oh gosh, and you're in your mind, you're going like, man, I did the best for you, right? And the reality of it is, yeah, but they're not seeing that. So you have to have all your tools prepared to talk to that patient, right? You have your before and after pictures, you know, to show them. But the one thing we do as surgeons, which is I think a little bit of a mistake, and maybe a younger surgeon, is we get defensive, and we're like, well, you know, you didn't do this, you didn't do that, and in the end, you know, patients is just venting. So I've found over the years that you just let them vent, let them get it all out, and then actually just accept what they say, and then the key to that is offering some kind of a solution, and make sure it's a solution that works for you as well. So, which means then, oftentimes, so I'll just give you an example for this particular patient who was very like unhappy. I said, let's just give it some time. Let me have you come back in a couple of months and we'll reevaluate everything. And if we need to do something, we won't, it's too soon to decide. And that phrase has really done a lot for me over the years. It's too soon to make a decision. So in other words, they don't feel like they're abandoned. They don't feel like they're left out in the cold, but care is ongoing. And so you have to be able to talk to an individual like that and be able to convince them. And then when they come back, then you have to have a solution prepared, which we can talk about later on. But always being able to listen, accept what they say, and then moving on to the next step.
Thank
It is
you.
very, it is very true, Arnold. It's
Yeah.
just so true. Because
Yeah.
I find the same thing on my practice, the unhappy patient knowing did you do the best for in your capability, is really frustrating.
It is, it is. Leading that, actually, right now we can move on to Omar. If you can share with us about how do you actually build the from the trust right now to align your expectations with the patient during the consultations so that you don't wait until when the result is out and the alignment is not there. That's when all the complaints and all the unhappiness comes in. So how do you do that in your practice to align?
Oh, for me.
No,
Uh,
Omar, for
oh, for
Omar.
Omar. Okay.
Sorry. Uh, sorry.
Omar, now you.
Yeah, now yeah, you say, Ping, I learned very early that it's not only about being the best surgeon, have the ultimate technology, know every little technique to do the same thing. It's about share with the patient, or build with the patient a link that let you reach out that that link on the patient, and hey, don't be crazy, let's wait, like Arnold said, it's too soon, let the result evolve, and is a game changer. Not be rushed for the depression of the patient, and know that you did and you're going to do for the result of the patient, and improve that result is going to make a difference on the state of mind of that patient. And it's very important to build that link, and wait and share confidence, take the hand of the patient and walking through the path of recovery, and see in the end the result the patient was expecting.
Okay, so can you tell us in your practice during the consultation, how do you actually align to make sure that you are able to align the patient expectations? So that means what you think in mind and what the patient have in mind is actually the same.
Yeah, I think I can resume that in 4 points. The first is clarified. Okay, let the patient describe their goal in their own words. Okay, then translate, turn that desire into something anatomical achieved. Okay, because sometimes the desire of the patient is not possible. Okay, then educate, show real results, and discuss limitation and risk, and then align, confirm that what the patient imagined matches what you can deliver. Okay, If you meet these 4 points, everything's gonna be right. Is some
Again,
of this is
go through
of
the 4 points again.
clarify,
Mhm.
translate, educate, and align.
Educate airline.
If
Okay.
if you have that 4 point covered, everything is gonna be fine. If one of these points is not good, everything is gonna fall apart.
Okay.
Is it my model?
Let's do a role play, okay? I'm the patient, and I come in. I'll say that, Dr. Orsini, I want to look like this.
Yeah, entonces, pero the first
I
the
want to
first
look like this.
is understand why the patient going to look like this.
Okay.
Then maybe this is not the patient one. Maybe the patient only want to get rid of the nasolabial folds, you know? Entonces, that is clarify, translate, then educate how I can achieve get rid of the nasolabial folds, you know, and
Mm-hmm.
then align. We can do this, and the result is gonna be like this, but maybe is gonna be that side effects, or maybe that is how to minimize unhappy patient.
But
Mm-hmm.
I think you have to negotiate with the patient that maybe he or she won't have the whole result, but maybe it will look better at some point or in the future or with this procedure. Not the whole facelift that he or she wants, but like an 80% better.
Yeah,
You need to negotiate.
Mm-hmm.
yeah.
What if the patient said that? What do you mean by 80%? Show me what is 80%. I don't know what.
Like maybe you won't have like the whole this, but maybe you will have like this, like not the whole stretch,
Or
but a little.
what about the patient? They said that I saw this in social media. Look, the Chinese, they in Taiwan, they are doing this.
Yeah, those
Doing
are the worst
3D,
patients.
and then they go up here, and that's it. Why can you do that? 45
I,
minutes.
I think one of
Or
the things, and
no mint cream only.
With no recovery time.
Yeah.
Yeah, yeah.
I think we all have this in our practices, but in my office, we have this huge mirror and a chair sitting in front of the mirror, and they sit there, and then I stand behind them and I do the pull. We call it the pull, whatever.
Yeah.
But at some point, as surgeons, we can kind of give them a fair preview of what you can expect. They come in, they show the phone, like, I want to look like this, and all this stuff. And he said, well, sit here in the chair, let's show you. And then you do the pulling. Okay, this is a fair preview of what you can expect. And I think that's one of the things that makes it a strong point of, like, listen, I'm a physician, not a magician, but and I use that phrase in a funny way with patients. And they're like, and most people will get that. They're like, okay, I get it. Like, so I can get you this, but I can't get you what you're pointing at, but I can get you like this. And if you're okay with that, then we can proceed. I think the word negotiate that Anya was saying is correct.
Yeah, and it's so true because sometimes a patient come in with a picture, I want to look like this, and part of the educate part of my 4 steps consultation, uh, I always say to my patient, my goal is not to make you someone else. My goal is make you the best version of yourself. And that's when the patient click in and okay, I'm understanding now, and you start to pull. I can pull a little bit here, a little bit, but not too much, because it's part of the psychiatric side of all of us, you know.
Does three of you have the can't view imaging device? What are your thoughts? Do you think that is actually a good way to match the expectation using a technology?
Well, me personally, I don't have that, and I personally would not use that. I know there's software for rhinoplasty, which is out there. Even for breast augmentation, the reality of it is, I mean, gosh, it just sets you up for really a bad situation, I think, because if you don't get exactly that photo that you basically printed and you sent them home with that, and they're going to come back with that, that's just because, obviously as surgeons, we know things don't always happen exactly as planned, and it's a human face. It's not like an image, a digital image.
No,
Mm-hmm.
So I would not use it.
I don't like it either. I try sometime one of the DOS software very famous on the market, and the percentage of the of the compatibility of the result with the predicted picture is so far from being a match, So I give up. I give up.
Okay.
A part of the is very expensive. I don't like to put that kind of pressure of on the patient and on me.
I also
Okay.
used to have it, but I also don't like it. As they said, it's very expensive and patients don't want to pay extra for that. And at the end, the consultation was like 1 hour more than the normal consultation. And they start just playing with the results. They don't like see it's
Mhm,
for
mhm.
like medical purpose. They just start to, oh, and how will my nose look like, and how will my face look like, and how will my breast look like. They don't assume it's consultation for just one area of the body, and at the end, to get the result they want, it just doesn't, like, you don't get there. I don't know,
Mm.
maybe for reconstructive it's okay, but or to get some measurements it's fine, but to show a result, I don't think it's worth it.
Yeah.
I
I
don't know if in the near future with the all these uh, IE going on, maybe this kind of software is going to be better and more exact on the predict results, But right now, I think it's not good to use it.
Well,
In,
I think
in my,
that's a learning curve for to use the firstly, I think as a doctor or whoever the technician, that's why in my clinic we used to have the Canfield imaging device, and it in terms of the conversion rate is 100%, which is actually very good as a sales tool. But then it match back to what you can show, make sure that what you can deliver is actually match, because if it doesn't match, then the patient gets very unhappy even though the conversion rate is 100%. And I think also another thing is also, yes, Anya, you're right, it takes up more consultation time. So then you have to say that, oh, should I charge more my consultation fee since it's taking up half an hour more, or should I not charge and give it for them free? But then when you give it to them free, then it's taking up your time, so then your revenue is actually being affected. So then the next question is that, okay, all right, why don't I train a technical assistance to actually do all this pre-consultation work first? But then if, let's say, for example, the technical assistants become so good, and then they said, look, you can achieve this with the doctor. And then when come to you, because you doesn't know what the technical consultant has committed, then there's a huge mismatch. So I think that's when, again, uh, is
And
happiness. But actually, having said that, like for example, in Asia, I know that very often they use like the tape just to kind of at least show it to them,
yeah.
to say, look, I tape here, I tape here. This is something what you can see and what you might be able to achieve after that. And if you want to do blepharoplasty, they tape the double eyelid blepharoplasty, so that then they can roughly see, okay, all right, is this the result that you want, and this is roughly what you can get. And they kind of it become more kind of a discussion to also understand what is their expectations, because after the taping they might know that, oh, no, I look weird, I don't want that.
so Pyn, all these devices, the software, the tape. And I mean, the purpose of all that is to try to make the sale, right? And that's why you said you have 100% conversion. If you gave a patient like the mouse and say, okay, click on all the things you want, and then say, yeah, that's what we're going to do for you. Your eyes will look like this, you'll look 20 years younger. Of course, you're going to convert. But the reality of it is they're a face. And as a surgeon, all the things that goes into what can go wrong and how the best we can achieve. So I think in the end, as surgeons, we sort of just have to accept this is what I can do. And this is as good as in my hands, the phrase is in my hands, I can achieve this. uh, you know, um, then just market and promote the best thing that you do. And I think that's how, and then you build the trust from there. I think if we start using the software, like, okay, we can try to get you this, or put the tape and we can try to get that, then you're sort of putting yourself into a corner that you don't necessarily need to be into. Because maybe you can't achieve that. So that's what I'm saying. I think we all know kind of what our limitations are and what our capabilities are. Maximize that, and there's plenty of work with just that.
Mm-hmm. So, Omar, um, did you have share with us your challenges? What is in your practice, have you ever have an experience where the expectation was definitely not met, and then patient was unhappy, and how do you
Yeah,
resolve?
yeah. Of course, I have it. Um, in the time I'm learn that Arnold say early that you have to accept the complaint of the patient, because the first thing you are doing wrong is put in your in defensive mode, and no, it's okay, no, you're not true, you're not right, the procedure or the surgery is going all well. This is the first mistake, because obviously the patient maybe is not right, but the patient feel that way. So we have to accept that and address that in the best way. And the best way is give it the time, accept that complaint, and look the best way to improve that result, the address that complaint. Because I have the in the I think the last case of the neck lift, it was a very fat patient. I have to do a lot of defatting with the visor and everything. And the patient have a little bit excess of fat right along the scar on the shin. And obviously, in the first day post-op, the patient complain about that. Look, everything is good, but I seen this bulging here, and I tell you, wait, let's wait, and I resolved it with the Morpheus. I did I always all my facial surgery have 3 sessions of Morpheus in the post-op. When I did the first one, I almost reduced that little the both in 80%. But if in the first hand I didn't accept that complaint, and put me in the defensive mode, probably this patient is gonna take away to other surgeon. Dr. Orsini, do the surgery and look at me. And that is the worst thing that ever is going to happen with the patient, because in the moment that patient lost the trust and go to other specialists, that is gonna the real problem is gonna appear.
Mhm.
Yeah, because not necessary that the other person will have a different opinion and will give a
Of
different.
course, always is gonna be a wise, and, you know.
So,
Try to keep it in-house. That's the
Yeah,
problem.
yeah.
That's the problem.
always keep it in house. Always.
Keep it in-house.
So you do,
Yeah.
so you redo the second times on the vaser back again to
No. With Morpheus.
with what?
With
Morpheus. Ah,
Morphos.
only with Morpheus.
okay.
It's a little bit extra fat rear next to the scar,
Mhm.
and we put Morpheus real deep and destroy the fat, and that's it. The patient with one session is 80% good, and I sure in the second session in about 1 month it's gonna be resolved. And the
Mhm.
patient right now is happy, but is very very unhappy in about 2 weeks ago. Very
Yeah.
unhappy. I I
Yeah.
I didn't see it, but I have to show you the pictures, you know, because you are very good. But this little detail, it was a deal breaker. No. I'm not good. So it's very important to understand and accept and then address.
Yeah. So for surgeons that is actually doesn't have devices and mostly what they have is their hands. So what would you advise them to do? Go back to the operating room and just
Maybe in this case specifically, maybe with a tiny micro liposuction is gonna be good.
Mhm.
Always wait, always wait. I think for a revision on face, I like to wait 3 6 months at least. At least best way scenario is 1 year to retouch anything. But obviously, all depend about the complaint and uh, uh, the thing that the patient want to others. You know.
So when is the can you share with us a moment where when there is a complaint that comes in? So obviously when a patient actually not happy, the first protocol is that they will call the receptionist first, right? They will call the nurse or someone that they can get. So so what is your what out of three of you, what detail, how do you handle? When did they escalate up to you? Do you tell the nurse to say that try to find out what it is first before escalating to you, or straight away the nurse has to tell you, report you, and then you guys work on it together? How
I,
does it?
I think one thing Arnold said early is in the moment when I put a scalpel on you, you have to direct line with me.
Okay.
And that is the most important thing. When a patient complains, you have to attend this patient. You don't hide. If a patient call my secretary or my nurse, I have these little balls here. I don't like the result. I don't like. Ask the patient come in to talk with you
Mm-hmm.
because in WhatsApp and no, it's not good. You have to talk the patient in person to understand, accept, and tranquilize. So give patient confidence about the everything that is complaint is gonna be addressed in time and in the right moment.
Mm-hmm.
If I could just add to that, when a patient addresses a complaint or they bring something up, like Omar was saying, you have to see them. And once you see it, you can make a decision as to what the solution is going to be. And then for oftentimes the solution is let's just watch and wait and have you come back. But even in that solution, which is really doing nothing, they still feel cared for and they still feel not abandoned. And if that's the case, for most of the time, a lot of patients, when they know that you're still there for them, sometimes the complaint almost goes away. But it's the one that you say, well, sorry, there's not much we can do, or maybe the staff says sorry and they didn't connect you with a doctor. That's that patient who doesn't feel they received any care or recourse. That's the one that goes online and starts saying things. And then the worst case is they go from online to maybe taking action, and that's, you don't want that. So always keep it in-house. And then the second point I want to make is real quick, Pyn, is that as surgeons, we have to be prepared literally to go back and do surgery. I mean, yeah, maybe you have devices that can fix the problem, but let's say, you know, a patient has a situation or a problem that really requires like, you know, a revision of some kind. Maybe it's not going to occur right away, maybe in 6 months, maybe even a year. That's okay. But we just, as surgeons, if we're prepared to do that, that really alleviates a lot of the tension that can occur. And I just want to introduce one phrase that we introduced in our practice, and that instead of using the word revision, which sort of has a negative connotation to it, the term we began using and have used for now is called phase 2. I know it's a silly way to look at it, but oh, you know what? You need to go into phase 2. And that way it's kind of gives you the feeling of a progressive movement rather than you're going backwards to revise a surgery. You know, I know the term revision is commonly used, but really it's like, hey, no, I got you 60% there, but you feel like the skin is relaxed. So I need to take you a little bit further along. So let's get you into phase 2. And it's a term that I think over the years I found has just been a little bit more of a positive spin rather than the negative feeling that you get from the term revision. So that's just,
I like
That,
it.
that, that is so wise, man.
yeah.
Yeah.
And
Yeah.
Anya, having said that, so tell me in your experience in your practice, right? Uh, how 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 did you actually get the patients to trust you based on you know, the collecting the certifications? You know, let's move into to what you think about the topics that is there are, because there are so many courses that teaches techniques, because right now we're talking about all the different techniques that you can use and personalize all the treatments for the patients, but very few, they teach you how to think, lead, and master. So maybe if you can share with us your experience.
Well, I will talk from the point of view of a young surgeon. When I finished my practice, I knew about most of the theoretical knowledge, but I didn't have the practice. So I was looking for um, somewhere I could practice and learn new techniques. And as my father is a former fellow of ECAMS, he said like, okay, go there and practice, learn something you would like to do in your future. And I said like, okay, I would like to specialize in face. So I went to ECAMS and start doing everything I do in my own practice, but I wanted to learn new techniques because, for example, I do a lot of blepharoplasty, but I wanted to learn new techniques. I said, okay, I do it every day, but I want to see how they do it in other countries. So I went to do the fellowship. I think I started with face. Yes, it was face. And we started with the theoretical part, and then we practiced in cadaver, and then we did the practical with live patients, which was very interesting. So we went from like books to cadaver and then live patients. So we built confidence in ourselves, and we could see how different doctors could operate in ORs. So I think that not only gave me the certificates, but also gave me the confidence to come back to my country and do different cases. Because, you know, in Latin America, we have like certain type of patients, but sometimes we receive another type of patients like Caucasians or Asians or I don't know, other races, and they have different features, and sometimes you don't know how to operate them, and there you learn how. So it's very interesting. And as I started practicing, I said like, okay, I want to learn more. And then I started studying other things like liposuction, and I did the fellowship for liposuction, and I was very happy to complete all the fellowships because I could say now I feel more confident and I can offer my patients more of a, like, I don't know how to say it, like
Different
different techniques, yes, not only the ones I study, but also the ones I've seen, because it's different when you go to a conference and just see the lectures when you practice it, and
Yeah.
you practice them yourself. Not You are not seeing someone practice them, you are practicing it yourself. So
Yeah.
that's what I like about ECAMS.
I think that's one thing. I today I just shared a video in the Instagram, because sometimes when you're doing it so often, we've forgotten, like even the simple thing, that the discussion before the courses on all the patient. So because I saw the video, Arnold and Omar, we were discussing about this patient. We were saying, okay, this one you will do, this one I'm going to do, this one I will do. What are we going to do? Why are we doing this? And that video, I was just, oh my God, this is so small, but yet it is so important, because this is what you will never be able to get it if you are actually in a congress or if you are in a product training.
Yes,
That
and sometimes
go
Yeah.
go go.
sometimes you want to discuss with other doctors a case, like what would you do, how would you approach it, um, even something very simple like the marking. How would you mark it? How would you do the anesthesia? How would you, something very like basic, but the simple fact of discussing all this makes you grow your practice. So when you go back home and then you do it by yourself, then you feel more confident. You can talk to the patients more confidently, and that shows.
Yeah. I think Arnold and Omar, you guys have also experienced the full fledged of all the different things. One of the things I very regularly I have received is that uh, I find there's a lot of doctors, they are collecting certifications so that they can show it to the patient. But very often, what the certificate is hang there, but it doesn't translate back to their real practical skill. If you
Yeah.
get what
I think certifications are obviously helpful. I mean, but if the purpose of the certificate is to make the sale, just kind of like this digital software, you're trying to make the sale, then I think you've lost something there, because, for example, I think when someone wants to promote all their certificates, it probably means they're maybe a little less confident in their own skill. The more skill you have, the less you need any of these certificates. You just want to bring the patient, come on, let me show you what I can do. And so in the end, it's really comes down to what are you able to do, like surgically, and I think to Anya's point, like, I think we think like residency, for example, is enough training to go out there and now do a practice. The reality of it is, I mean, we need constant education. So I think it's important to keep getting education. But if you can have an educational situation where you can actually do hands-on, practice, that to me gives you the greatest value, in my opinion.
Anya,
Yeah.
what is the biggest mindset shift you have experienced after you attended our course or the mentorship?
The biggest what? Sorry.
The biggest mindset shift that means making you
Ah,
look
okay, okay.
very different way.
I think I don't know. Maybe, well, I already knew I had to learn all my life, continue learning. But I think, wow, I don't know. Maybe the fact that some techniques are not that different
Mm.
in in different countries. I thought that maybe will be, I don't know, very different Mexico from Turkey, and they are very similar. So that was mind blowing. Yes.
I think one of the thing is that it's so, as a surgeon, it's so difficult for either experienced or novice. It's so difficult to differentiate, because sometimes you, like, for example, when we run this course, we know that deep plane was actually not so popular, and then suddenly deep plane become the
It became very popular. Yes.
yeah, it become the
Yes.
trend. And everybody think that I must do deep plane, and patient think that, oh my God, if you don't do deep plane, that means you are not good enough. But then these are, so it's difficult for doctors to differentiate between trend and I think it's the selection of the approach, because I think for to personalize your patient, each patient comes in with no two faces is the same. So you definitely have to have different tools in your pocket in order to be able to make the decisions when and why and how, rather
I
than
think you have
techniques.
I think you have to keep in mind that the patient you have in front of you still a patient, and you are not following social media or trends. You need to analyze what's best for him or she, and see if actually deep plane is good or not, and why, and share that knowledge, and not say like, okay, deep plane is trending, so we're doing deep plane on everybody. No, you need to analyze if it's good and explain why, and actually, yes, learn how to do it and do it if you need to.
Yeah, I
I
think
think
the,
it, I
yeah.
think it still comes down to what procedure that you do gives you the best results. I think there's a tendency as surgeons, like we go to different courses, and then now I want to do surgery like Dr. So and so. Oh, I want to do a surgeon like whoever it is was the speaker. And the reality is, you're you. So go home and do what you do the best, and then promote that. And if you can get really good results that the patients love and are happy with, then that's how you do it. You don't have to follow trends or listen to even patients. So they say, I want this type of procedure. Just do whatever you do best that gets you the best results. I think it's important that we keep going and getting education, watching the different techniques. Whenever I go to a course or whatever over the years, it gives me one of two things. I always say this when I get back home. I say either I learned something brand new that I didn't know before, or it confirms that what I'm doing is good. Like, okay, if all these surgeons from Italy or Brazil are doing that and I'm doing that, okay, I guess we're up there. Because a lot of times as surgeons we feel a little bit isolated. We don't know if our technique is actually on par with everyone else. And so when you see things on social media, you want to emulate that. You don't need to, and that's why going to courses is important. But you realize, you're your greatest asset. So maximize what you do best. And believe me, it'll translate into happy patients and a thriving practice.
So what I understand is that is that learning is continuous and it is important. So then, as I said right from the beginning, there is so many training courses out there. And then for people that is just starting, I think like there's a questions here by Dr. Sarish. He just started with hands-on courses according to the learning objective, and how you can choose or combine, or how you can go for fellowship if you want to learn whole thing. So I think the very common is that which one to choose, and what to choose, and why to choose. Where, who should I be going? Should I be going to this surgeon to learn from, to learn this, or should I go to ECAMS, or should I go to congresses? I think this is the confusing part for them, for a lot of the doctors.
Yeah, I think everything is good. You have to do congress, you have to do observer training, but if you want to really craft your skills, is not shortcuts, okay? But I are a smarter path like ECAMS, because in ECAMS you get in to know the theory by great mentors. You're going to cadaver lab, and then you're going to live surgery. So this is the real thing, and be in touch with so wonderful mentors, it's the key of the of of this process. Because I always remember a phrase from Richard that try to learn facial surgery seeing videos or into Congress is like to pretend learn to play golf seeing professional players playing golf. You have to do it with your hands to learn. And in my point of view, knowledge give us safety, and experience give us confidence, and that confidence is what patient feels in the very field consultation, and that's going to let you make your practice grow and make your patient your patients happy.
Yeah, yeah,
I
definitely.
think one other thing to add to what Omar was just saying is um, repetition is what gives you confidence. You have to do a lot of these. So first of all, you might learn in a cadaver lab, you might learn with live surgery, then you go home and you have to do a lot of the same thing over and over again to truly master it. You can't just do a little bit here and there. And I think this is, at least for my own self, like focusing on just the face versus when I was a younger plastic surgeon, I did the whole body. I do face, boobs, tummy, and I was kind of a little bit lost everywhere. You can't really master anything if you do too many things. So by focusing on one area, you're able to just do just that thing over and over again, and then that's how you gain mastery, not just the procedure, but how to talk to the patients and how to handle complications, staying focused on that one thing.
Yeah, I think that's the reason why we actually over so many years, that's the reason why we structure our course this way for the fellowship. First you do the cadaver lab, you learn the complication management, and then you move on to the live models, and then you do your logbook because we need you to practice, and because if you don't practice, you're going to lose that. And then later on you take 2 years to complete. That's also the reason why we streamline to only 2 years, because we are trying to force you to get out there and practice it. And I almost actually most of the time, if there's a doctor to say that, look, I'm not ready, and I will be ready only for 2 years, then I will tell them, please, when you are ready, then you come and attend, because there's no point now you learn. By the time 2 years later, when you're ready to start practicing, you're going to forget what you have learned. So it's better that you actually have the continuity. To us, continuity is very important. And that's why even for the fellows, after the fellowship, we don't just say, okay, bye, fellowship, there you go. We're so happy that you're here with us for the for the past few months, and thank you, and we're happy. No, we continue to catch up with them, come back, assist, contribute what you have learned, what was your experience, tell the next generation, tell the next people that is actually trying to come in, share their experience, because I think it's so important. Aesthetics industry, when you come into it, can be quite brutal and can be quite isolated. And that's why we need each other in order to grow, and to really, that, okay, if I even if you have a complication, that, okay, I have all the experts to be asking, what am I supposed to do, what am I going to do? Tell me. Give me your opinion. They might jump in you and give you lots of different opinion. You might be overwhelmed, but then at least you have a support. And this is actually also very important to build the trust to your patient, because when your patient know that, oh my god, you actually have a group of mountain behind you, they know that when it is in trouble, they have you are not going to, you are not doing it alone, because you have a support group that is actually trying to say that, look, let's do this, let's do that, can we do this, can we do that, what about this, do you have this paper, is this paper written, do you have any paper that is actually being written like this? So that is so important. And there's also another questions from Kenneth. Just now we were talking about the social media. So he's asking, Kenneth was asking, he said, how do you promote maintenance to the patient? and also what's the best social media approach to build a practice.
Wow. So early on when I started, we built our Instagram, for example. I had someone in-house who would she would come in and she would shoot our videos, or she would take the before and after pictures and put them together, and then we would just post. And I think in the end it was fine, but it didn't allow the practice to grow as rapidly, because I think people who scroll through do look at the number of followers, and I think they view that as a sign. So I think at some point you do have to invest in your social media, and I mean by like actual invest money to grow your followers, so that you can have a presence that folks who see your work, feel like, okay, this is like a legit, practice. It's very interesting because sometimes, obviously as surgeons, we feel like our skill or our knowledge is what counts, our certifications, what have you. But for a lot of people out there, and I get this all the time, is like, yeah, your social media is really the thing that drew them to you in the first place. And so you realize that that's something worth investing in. So I think, whether you start small, Instagram, Facebook, you have to start somewhere, because it's sort of like the on sign of a business, like we're open. When you haven't posted in a while, people notice that, and they're like, oh wow, I wonder if they're still open. I wonder if that business is still, if they're still working, because they haven't seen much. So it's something that is definitely part of being in practice in today's age, and it's important to invest.
I know, Anya, in terms of social media, you are quite quiet, right?
Yes.
So
Well,
what is
actually, like my private social media, it's quiet, but my clinic social media, it's a little bit bigger. But also I want to share something. Depends on the country. You need to check if you need some permission or not. Because for example, in Mexico, we need to tramit a permission, like a Instagram permission, like Facebook permission, YouTube permission. Like even if you're doing, I don't know, like no before and after pictures and only posting, I don't know, social media, like to do like just you and no patient pictures, you need to have an advertisement permission. So it's very important you know the rules of your country before you get a problem. So check
true?
that.
Because I think Australia has also certain limitations of what they can post. In Japan, they can't even post. Same for Hong Kong. Taiwan,
Brazil also.
oh, Brazil too. Okay.
Yeah.
In Ireland, in UK, in Italy, and Greece, there's no limitation. You can do anything you want. So yeah, I think checking the regulation, I think, is important. In Ireland, the only thing I don't know why they obsess, we cannot use the word Botox in anywhere. So
Hmm.
we have to say botulinum toxin. So we cannot say Botox in website, in social media posts, because your competitors will straight away do a screenshot and send it to medical counsel. so so we always have to use, all the different way, botulinum toxins, the toxins, and this and that, pricing for the toxins. So even if you have Botox, costs how much? No, you're not allowed to use the word Botox. So yeah, so do find out on all this regulation. Actually, so since right now we are having a discussion, I wanted to, participants, if you actually wanted to turn on your speaker and ask us questions, feel free to do so that you participate, or you have anything that you want to share with us. Do jump into these conversations. Uh, Another thing about the social media postings, right? um what type of posting, how regular should it be, and what type should it be? More information or more before, after, or, or more like dancing?
No
Dancing
dance,
or a
no,
skit?
no dancing, zero dancing. I think the type of content that you're going to suit your Instagram profile is going to talk about yourself, if you're not like me, I know the type of gonna be dancing and funny guy. If I going to try to do some time of content, it's gonna be fake, because it's not who I am. So I think the content is gonna be truthful to yourself. And I think to build confidence, you have to be to give content of value, educational content, and of course some before and after, because the people want to do what you do and what result that you can achieve. But I think the best way to build confidence, to build authority, is the educational content.
Mm-hmm.
Invest in that, and all of the other things is going to be uh, behind that.
So one questions for three of you, okay? If you could go back 10 years, what would you tell your younger self about building a practice?
Go to ECAMS. No, no, I really mean it. I
Yeah.
really mean it.
Yeah.
I follow ECAMS 10 years ago.
Oh, really?
Yeah, no, I showed you my mails. I inquired to ECAMS, but I don't know, it's 10 years, but very, very long time. And because in my residency, when I graduated of plastic surgeon, I don't know, we don't come out with a lot of facial surgery experience,
Mhm.
and I think always I think I need that kind of training, and take me a lot to go through with the decision to invest in that kind of training. And if I have to give any piece of advice, is don't think, do it, because it's worth it all 100%.
Thank you. And how about Anya?
Yes, I think it's worth it. You will get your money back with your own patience.
Yeah,
And if you are doubting about either if, I don't know, you don't have time or you don't have the knowledge or the money or anything, just do it, because in the end, knowledge, it's priceless.
yeah.
Thank you. Guys, for those that is here, I really did not pay them to say all this, okay? I have to make sure. And what do you think?
For me, the greatest value of ECAMS, and something that I wish I recognized sooner, was not only camaraderie, but also the network. As surgeons, like we all said the same thing. It can be sometimes isolating as a surgeon. You're in your practice, you're making all the decisions, you're by yourself, you're handling all the problems, and then you don't realize, or you realize when you go to something like ECAMS or you join a network, that hey, man, everyone's experiencing the same problems that I am. There's a lot of surgeons that we share the same stories. So that to me is the greatest value. If you're a young surgeon, get into the network already, because then now you have all these people that you can learn from, you can ask questions of. Anya was saying, like, man, if you have even just how to do markings, if I had someone that I could just call right now or email, that would be so nice. And so the network, and the mentorship, to me, are the greatest value that you get from an organization like ECAMS.
I think one of the mission that when ECAMS was created is actually to really create a family to really, because I when I start to come into aesthetics to build the clinic, it is, if I have one person that is willing to give me this kind of a webinar just to tell me this, I will pay him anything so that I can understand, because I have, to build everything from scratch on your own and without somebody to say that, yeah, okay, you are taking the right step. No, 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 this step is actually not going to be good for you in long run. Somebody to even just share that experience, I think is priceless. And that's the reason why when I built ECAMS, that was the sole purpose, is that we want to build something where everybody is sharing together. And I think in especially in medicines, w- um, I don't come from a medicine background, because I come from the IT background. And if you look at the IT technology, that which I always use this analogy, IT, computer, AI now is advancing so fast, is because all the engineer group together, and then they share information and they build up each other, then they build together. But aesthetics, on the other hand, is the only industry that I come in and everybody is trying to backstab and kill you. Everybody is trying to push you down to the cliff and give you the wrong direction. And this is something that definitely we don't want to create. Nobody that is pond, the pond is big enough, the ocean is big enough, all the fishes is more than enough for everybody. And I think, and when everybody come together and learn from each other, and that's when the standards will improve. And the most important thing is patient get what they deserve, because it's an elective procedures, it is private procedures, and it's something that is their hard-earned money that they are putting the trust into your hands. And as a doctor, you have a lot of responsibility to do it well for them. They don't pay to end their life or to be disfigured. Am I right to say that? I'm coming from a patient
Yes.
perspective.
Yeah.
Yeah. So
Yeah.
so anything else that uh that that you guys can, when things get rough, say for example, yeah, one last question that I wanted to ask, if there's one thing you want every surgeon listening tonight to take away, what would it be? Anand, you come first.
Learn how to do a facelift under local anesthesia. I'm actually being a little bit funny because that's what I like to promote and teach. But at the same time, I can just share it with you. Like for me, doing it under local means you can do it in your office. If you can do it in your office, you bypass all the steps to get a patient into an OR. And when you can do that, then you can do a lot more patients faster. And you want to get the repetitions, because that's really how you gain mastery, is repetitions over and over again. So pick the procedure you like to do and do that almost exclusively for several years. They say, you gain mastery when you do one procedure 1,000 times instead of like 1,000 procedures one time. So mastery by focusing on a single procedure, I think it would be the advice I'd give.
And Anya?
I think be patient, because now with social media, patients are getting higher expectations and you need to educate them since consultation. So be patient.
And Oma,
Yeah, I think
a takeaway.
try to align what the patient feels with what we you can deliver. That is when aesthetic surgery becomes truly ethical, human, and lasting. I think is the is the my thoughts to go home.
True. Now, for those that is that still left 19 of you that is participating, do want to say that our facial surgical immersion week is actually in November from 4th all the way to the 9th of November, and Arnold Omar is going to be there. Anya can't join us, unfortunately. I think I've forgotten to ask you.
You didn't.
I'm sorry. So
Excellent.
anyway, next time she's definitely going to be with us. So this is one of the things about the being a fellow with us, because we definitely would want our fellows to be keep in touch with us, assisting us on all the courses that we have, so that to keep their knowledge keep going. Anyone else have questions for this tree? For
Uh, I actually I just popped in my question in the chat box. I'd like to know that how does like 4 to 5 days of immersive and hands-on learning, which might be on maybe 3 to 4 patients, would equip me and make me confident, even though I'm pursuing various other diplomas and degrees from UK and India, to create a clinic of my own. Yeah.
Yeah. So, Arnold, I think, okay, because Arnold, Omar, and Anya come from a very different. So maybe this case will be more related to Anya, because when you joined us, you were also at the very starting phase, right?
Yeah.
Yeah. So maybe you can share your experience, how that short period of time you are able to gain that confidence.
Well, I think try to get as much practice in that short of time as possible. I mean, you will get certain cadavers and certain um, hands-on training during the time you are there. But I was all the time trying to look at what the others were doing, and if someone asked for help, I was there looking to help, and also talk to the doctors who are training there and who are teaching there, and build relationship with the doctors, because sometimes they can, I don't know, invite you to other practice and teach you while you are there. So even if you are there for a short amount of time, you will get enough practice to master what you are doing. I don't know if you're doing face or doing only blepharoplasty, or I don't know. But you will get the knowledge you are there to learn. So be confident.
Yeah. I think one of the reason why we are structured it that way, because live models hands-on, I can say that it is very, very rare. Even there is certain education that says that they are doing live models, most of the time you are actually watching, maybe touch a little bit on the suturing part. But what we do differently on our live models training, you get one patient, the faculty do one side, and then you do the other sides on a very close watch, intense watch. That's why sometimes the procedure takes much longer. Even though you only have one experience on one patient when you're really doing on one side, that amount itself actually kind of click in, because when you are doing the cadaver on all the different techniques, cadaver no matter what is still a cadaver, so it's not like live models. So when you do the live model, that's when everything kind of magically gel in, and it gives you that confidence. When you go back, you can actually mimic and understand how to do it. And that's also one of the reason why we say that do the logbook, so that you can then start coming for the clinical mentoring, because the clinical mentoring is actually the important bits and pieces, because that is when, that's why we always say that we don't know, we are not going to discuss about the clinical mentoring until after when you finish coming in, because and you have start doing the cases, because that is when you realize, okay, I still not sure about the under and the lower eye blepharoplasty, and I'm not sure about the neck, or I'm not sure about the deep plane, or I'm not sure about these certain techniques. So that when we arrange the clinical mentoring, either it is in your premises, we prefer it to be in your clinic, so that it is your environment and your patient, so that you can follow through all the way, and our faculty will be there to guide you. That is when you really, that is an additional push to really put, is like the cherry on the top of the cakes, where you really um, uh, able to fill up all the gaps. at the end of the day. So I think that's why it is structured in this way, so that the doctors can have the full fledged from starting to end to end, if it makes sense, if you get what I mean.
Yeah.
Yeah. So
And
answer your question, Triti.
yes, it does. Thank you so much.
No problem. And any other questions?
Hello, I would like to make just one more question. Um, how is like a fellowship? How does it work? I mean, I've heard about the congresses, the seminars, and everything about ECAMS, but never about a fellowship. Or how do you get accepted, and what are the steps?
So for our fellowship, say we have in ACAMS we have 6 different types of fellowship. So we have the facial surgery fellowship, we have breast fellowship, body contouring fellowship, aesthetic medicine, which is all the injectables fellowship, and also we have the genital fellowship program. So our fellowship, how it does is that it goes by, first you have to do, there is a compulsory module that you must fulfill. For example, like the facial aesthetic surgery, you must do the cadaveric dissection, which is the blepharoplasty and the facelift. But even before this, let's say for example in an event we realize that you maybe you have never handled a facial surgery before, then we will request you to attend before the cadaveric dissection. There's another one which is called the suturing and also complication management, because we need you to actually understand to select which type of suturing, because believe it or not, if it's anything to do with surgery on the face, the patient, they don't really care what you do inside, but they care what your sutures and your stitches look like.
Yeah,
They,
of course.
they mind or not. So that's the reason why that become a compulsory module for us if somebody is not familiar with the facial surgery. And also, of course, we need you to understand how to handle complication. If you have neuropraxy, um, if you have uh,
Hematoma.
yes, all kinds of all the complication you need to understand. And if you have unfortunate situation, need to do a skin graft, you need to know how to do a skin graft. So that course itself is just 1 day before the cadaveric dissection, just so that you are more familiar with it. And once you get that, then you do the cadaveric. So the cadaveric, we start off with the face. One side we do all the smart lift, max lift, local anesthetic facelift, gliding facelift, to give you all the different techniques. And then after that, we move on to the other side, which we do all the deep plane, Tesla technique, modified techniques, using the energy device, the classic deep plane, because even deep plane itself, there's so many different levels of techniques that you can do, vertical, lateral, and all this. We always have discussion with Arnett. He's like, oh, what do you think of this, what do you think of that? We form a little group and we discuss and we bitch about other techniques.
Okay,
So,
thank you. Thank
and
you very much.
and then after that, we move on to the live models, because the live models is 3 days, and then you have the blepharoplasty. Each doctors will do one side with, and then the other side, and then you watch the others do. So they take turns. So maximum we only take six doctors for blepharoplasty and 4 doctors for the facelift. Then after that, you go. We also have the regenerative fat grafting, because right now these 3 modules is actually a compulsory module. But unless if someone say that, look, I actually want to focus on rhinoplasty, then instead of the fat grafting, they can do the rhinoplasty. So this will complete all the modules that you have. But then you need to do the clinical mentoring. But before you do the clinical mentoring, we actually want you to start doing a logbook. You need to have a minimum logbook cases of 25 cases. So that, because once you start doing it, because if you don't start doing it yourself, you don't know what is your weakness, you don't know where you need help. So only then when you start to do, then you can come back to me and say that, look, Pyn, I'm actually very weak in the facelift. I want to do the clinical mentoring. I want to do 2 cases of facelift and 1 case of eyelid surgery, lower eyelid, because I'm okay with upper eyelid. So then we can come back 2 days. There will be a private training we prefer to be in your practice, but of course, in certain country, in the practice is actually not possible, then you can then come over, we can arrange for you to come over to our faculty clinic, or we will have to find a space for you to actually do the clinical mentoring together with our faculty and find you the patient. So that is the clinical mentoring. So this complete the whole, fellowship program. So it is not, it's not an easy process, but it is a step-by-step structure, because by then we are building up a lot of confidence level in you, and then you are actually guided in such a way that you don't take unnecessary turn, because when you are figuring out yourself, you waste a lot of money on all the congresses, conferences, product training, this and that, buying machine that you not necessary, why you buy that, just because the product company said that this device is good or that device is good. So, and yeah, so this is our fellowship.
Thank you very much.
Okay, any other question? Okay, so since we don't have any more questions, so what thank you all of you for attending, and I hope we should do this more often. Well, I really want you guys to give the feedback for those that has attended the course, the webinar. Let us know what you think of this, and next time we should arrange it again, and we can have another chat, maybe on different topics. Give us your suggestion, what topics you want to hear from our fellows, maybe all their complication, if they have.
This has been great, Pyn. Thank you. I'm glad you put it on. It's good to
Thank
see
you.
you, Anya and Omar.
Thank you so much.
Yeah, thank you, Pyn.
Thank you so much, everybody. Thank you, and I will end
All right.
webinar. All right, bye.
All right. Bye-bye.